How to cope with andropause. As men age, they can experience a phenomenon, which is similar to female menopause, called andropause. By the time a man reaches the age of 30, testosterone levels begin dropping by about 10% every decade. Young men often have testosterone levels exceeding 1000 nanograms/dl. Look at the comparison of an 80-year-old man, whose average testosterone is 200 nanograms/dl. Between the ages of 40 and 55, bodily changes occur very gradually in men and may be accompanied by changes in attitudes and moods, fatigue, a loss of energy, sex drive and physical agility. In addition, attitudes, psychological stress, alcohol, injuries or surgery, medications, obesity and infections can contribute to its onset. This also seems to happen at a time in a man's life when they begin to question their accomplishments, values and direction in life. Therefore, it is often hard to realize that the changes that are occurring are often related to more than just external situations. Although age does play a factor in testosterone levels, there is no way of predicting who will experience andropause symptoms and to what degree of severity. Neither is it predictable at what age symptoms will occur in a particular individual. Each man's symptoms may be different. It has been shown that a man's physical health and mental well-being can play a part in the varying degrees of signs and symptoms. Men who eat right, exercise on a regular basis and are content in love and work, seem to experience symptoms, much less and/or later in life than those men who are obese, physically unfit, unhappy or depressed. Productivity is at the center of a man's existence. A man's productivity is what gets him noticed and appreciated. This helps him climb the ladder of success, bringing home the bacon and be recognized as the breadwinner. As he ages, the productivity tends to switch to self-satisfying tasks and those, which give him purpose. The scoop on human growth hormones, HGH. Some scientific evidence shows that trophic factors, such as growth hormone, estrogen, and testosterone, may help combat the aging process. Ways to cope with andropause. Change your diet, cut back on the fried foods, saturated fats and sweets. Eat cleaner, healthier, live food. Eating is a learned behavior, so poor eating habits can be unlearned. Get moving. Exercise not only is a great remedy for depression, it is a great hormone builder. It truly gets the juices flowing. Have more sex, safe, satisfying, mind-bending. Remember, our mind is our most powerful sex organ. Use that to your advantage. Find more satisfaction in your work, not doing the job of your dreams? Don't you think it's about time you did? Put your fears away, for once, and just go for it already. Make your relationship the best it can be, if you have one, mix it up a bit. Make it new again. Go back to the basics. Send flowers, go somewhere new, go out on a date. If you don't have a relationship, then try directing your intentions in the right place. Coping strategies are important. Talk to others who may be experiencing what you are feeling. Find some therapy in a group session, a private therapist, or go online and find a chat room. Strengthen mental attitudes, positive thinking. Maintain a sharp, mental approach. Live intelligently. Take control of your life. You are responsible for living a longer life. You alone. You are in charge as to how long and how well you will live. Stay creative. Fresh ideas are one of the best approaches for improving any area in your life. Get inspired from things around you. Stay healthy. Good arterial health is a must. High blood pressure, high cholesterol levels, excessive stress, poor diet, lack of exercise are your ticket to a downward spiral. Know about andropause. Similar to women, men as they age experience an increase in cortisol. Cortisol is a hormone that assists with stress management. While producing more cortisol, men at the same time produce less testosterone. Since most men are not aware of the circumstances in andropause, they do not understand about mood swing. This is why this makes them hard to approach. Educate him. Men should know or must be aware that the loss of testosterone can lead to decreased energy level, reduced sexual desire, muscle pain, and depression. All of these symptoms can trigger mood swings. If ever a man brings out the topic, be sure you could answer all his queries, and if he becomes defensive, you can tell him that you have just come across with some information and had found it very interesting. Be supportive. Be there to support him and let him know about it. If you two are going through menopause, well and good, as there can be mutual support and understanding on both parties. You can both share your own experiences, including those of your friends, whether a man or a woman who had an experience regarding mood swings that are associated hormonally. Try any helpful diet. Testosterone treatment is not the only option for mood swings in men with andropause. A change in a woman's diet which is helpful as she ages can also be helpful for men with andropause. This includes eating more soy, fruits and vegetables, most especially tomato products, which are known to help lower blood pressure. Let him know that fatty foods are not helpful, so they must be eliminated in his diet, and must drink sufficient amount of water. Undergo stress management. Maybe the two of you want to learn about stress management, so why not invite him to attend a class? Stress management is vital for those who are experiencing andropause and to those people dealing with this person. Couples counseling is applicable in any relationship regardless of age. This is yet one thing that you can do to stop mood swings with andropause. They focus most on coping skills, mutual goal setting and respectful communications. Try to approach your man in a respectful manner if you want to suggest counseling. Explain to him on how you are eager to learn on how to deal with aging, instead of telling him that he alone has problem and that he needs help. Get the right amount of sleep. There is a reason why experts and health enthusiasts recommend at least 6 to 8 hours of sleep. Your body needs to rest too, so don't deprive it from its well-deserved rest. When you were a bit younger, you tend to compromise sleep, because of the need to finish every task assigned to you. Now that you're older, it's time to slow down and get as much as ZZZs as you can. It's not just about gaining your energy and giving your body some rest. Getting adequate amounts of sleep can also boost your testosterone levels, which is exactly what you need at this point in your life. Go ahead and visit the dreamland. It's going to make you feel better too once you wake up. Don't say no to fennel. Fennel may be a popular vegetable in Italian dishes. Did you know that it could treat symptoms of andropause too? Believe it or not, this organic ingredient can do many wonders for your body, including your man down there. Aside from boosting your libido and improving erection qualities, fennel can alleviate symptoms of male menopause, too. Consider ginkgo biloba. Aside from tongkat, there is another herb that can also be effective in helping you deal with andropause. This is known as ginkgo biloba. This fan-shaped leaf is a common herbal ingredient in most male enhancement pills for a reason. It enhances blood circulation, especially down there, which eventually boosts your libido, improve the quality of your erection and enhance your memory. However, side effects may include dizziness, headache and dyspepsia, so take it easy.